Hi guys, it's been about 4 months since my microdiscectomy surgery. I wanted to give you an update. I know I've kind of been distant and not posting anything on YouTube for a while. It's been a really downward spiral journey that I've been on since my microdiscectomy surgery. And I just wanted to kind of update you. I've written down some stuff so I don't forget because it's a long story. So I'm just going to kind of read some stuff off. So you remember that I had my microdiscectomy on my L4-5-S1 discs, so that's my lower back. I've also been diagnosed with fibromyalgia, IC, endometriosis, and chronic pain. I have chronic back pain, leg pain, hip pain, and I really have to say that I regret having this surgery. I wish I never did. I think about it almost every day as to why I chose to sign up for that, and he made me all these promises that he was going to fix me and I would be better, and none of those things are true. In fact, I'm 1,000 times worse. So I would be up to my regular activities probably 2 weeks after the surgery is what he said, and I'm probably now what you would call completely disabled. So that just kind of goes to show you. I've been in the house for 3 months, barely walking, barely making it from room to room. I can barely function. I just recently returned my hospital bed that I had rented, thinking that I would only need it for a few weeks, and it turned out I needed it much longer. I also had an incident with a chair that I rented to kind of help me, and I fell off it. It came crashing to the ground, and it wasn't installed properly, so it was their fault. And obviously when I fell, it was extreme pain that I instantly felt in my back. I felt a popping sensation, and following with that, numbness and pain in my leg. With thinking that I probably just bulged out another disc, I immediately went into bed and thought and prayed, hoping that it would just go away, and thinking I'm not about to go to the Emerge for yet another incident. I waited a couple of days, actually, and my mobility was 0. I couldn't walk, so my mother made the decision to call the ambulance, and they took me in, and they actually treated me horribly. They did not want to do another MRI on my back to see if indeed I ruptured more discs or did more damage. They said I just had one in January, so pretty much loaded me up on painkillers and sent me home. I had the flu probably about 3 separate times in the 3-month span that I've been trying to heal from this. I don't know how I've gotten the flu because I've been mostly home, so probably my loved ones and the people that come to visit me are bringing me in winter germs. Fun. I had a stomach type infection as well that lasted a couple of days, and it was horrendous. I was crawling to the bathroom. I was having horrible diarrhea, vomiting, pretty much feeling like I had malaria. It was horrendous, and already feeling weak, I was even weaker. I lost a lot of weight, and I didn't feel like eating. I lost my appetite, and of course the pain in your lower back, as you know, is much worse when you have to go to the washroom and you're vomiting at the same time. It's a lot of pressure in your back, so it made things a lot harder for me. I suffer also from migraines that are debilitating, and I've had those as well, so that means more vomiting and more pressure on my back. I could barely lift my head up, and I've had about, I'd say 5 episodes in the 4 months that I've been healing of these horrendous migraines. I'm going through all of these sicknesses I had, continuing with my numbness in my left leg down to my foot. I have ankle and foot cramps that are horrible. I have pain in my right leg with sciatic. And when I say sciatic, before I had the surgery, I would have bouts of sciatica, but nothing compares to what I have now. I know that people say that they go for the surgery because they want to get rid of the sciatic. I went for the surgery to get rid of the leg stuff. I didn't really have sciatic. I had mostly pain in my back and like numbness in my legs. Now that's changed, and I have horrendous sciatic that if they asked me to do another surgery and promised again to have it fixed, I would go. So right from my lower back, right through to my bum and down to my toes is where I have my sciatic. I also get a burning sensation in my legs, like they're on fire. I have where I feel like I've dislocated my shoulders and my hips, my ankle, and just in my back overall. In my groin area, my pelvis feels like it's tilted and I'm not in alignment. Which actually the chiropractor says is quite common for women who have these type of surgeries, that they lift you on a table and they can actually dislocate certain parts of your pelvis. So that's something to think about if you're having problems right now. So my whole body feels completely thrown out of whack. My hips feel like they're rubbing together like sandpaper. The joints feel very tight. When I move, my joints don't have any fluidity. Everything feels sticky or stuck together. There's no, when I move, it's very slow. It's very kind of rigid and sticky. And thanks to my endometriosis, every time I do try to move, I feel a pulling, tugging sensation because the endo is in my bowel and my bladder, my pelvis. So everything is stuck together in there to begin with. So to have this extra thing is just 10,000 times worse. So that's really making it difficult to do any activities at all. I've also had lovely food poisoning 3 separate times, which took a toll on my body again. I had a kidney stone in my back, in my kidney, on my right side, and I luckily passed it at home, but I was sick for about 5 days with, sorry, gotta turn the page, horrible kidney pain in my upper back. So even though I passed it, I still had the symptoms of it and really not feeling well. I had a fever, I was vomiting, I had blood in my urine, and I overall felt like very fluish, no energy. I had gone to the washroom in the morning before I went to the hospital, and that's when I passed the stone, which was really not great when you have lower back surgery. I was in the hospital, taken by ambulance. The firemen came, and it was a very long process to get me there. They treated me really, really, really good. They put me on pain medication right away before they even touched me. They could just see that I was in excruciating pain. They did an ultrasound to make sure it passed. They did blood work and different things like that, and pretty much just sent me home as usual, as per hospital rules. So that was really tough on me and my family to have to go through that. As well, I also have a bladder infection. I've had about 3 of them so far in this whole time of my surgery. I got a cyst now in my right ovary. It's been bothering me for 7 days. I had not slept. I'm picky with what I'm eating. The pain is so bad and my whole right side is swollen. It's hard to really do anything besides cry and scream in pain. The pain is now getting to me emotionally and not only physically but mentally as well. My hair has fallen out. It's very, very, very thin because of the stress of chronic pain and just the stress in my life. that I'm dealing with. So it is taking a toll on me. I have, like, my skin doesn't seem to be as glowing. It's very kind of dull. I'm 28 years old and I feel like I'm 80. I walk around like I'm 80. I have my walker and my cane that helps me get around. I still have the cyst there, and I guess it will shrink on its own. I probably should have went to the Emerge for it so they could do an ultrasound and put me on medication, a course of antibiotics as a precaution in case it did rupture, because that would be dangerous. I feel it twisting and scraping my insides. And if I get up too fast, if I bend a certain way, it really pulls and stretches and hurts. This pain I've had pretty much been my whole life combined. It's probably in the last 3 months has been the worst. Like, everything that I've had to deal with has just been a nightmare in the last 4 months now. I can't begin to explain the fibromyalgia side of things that have gotten extremely out of control since the surgery. I guess I'm really in a fibro flare-up right now. I have a body ache from my tip of my head to the tip of my toes. Every inch of me hurts. My eyebrows hurt. My toenails hurt. It's just an overall ache. My sense of smell is heightened. Things bother me a lot. Sound, sight, just different smells can bother me and set me off. They can give me migraines. They can make me throw up. My eyes are bothering me. They're burning all the time. It's very difficult. The clothes that I'm wearing, I don't like certain material on my skin. I don't like certain things, how they feel on my body. I also have problems with my ribs, where anything tight along my rib cage and my back and my front, my ribs are extremely tender, so it's really, really painful. I get swelling along my rib cage and into my breastbone, so any type of pressure on there sends me through the roof. That pain is horrible. So with that, I'm dealing with more than just one issue. I feel like it's a domino effect happening, though, after the surgery, with one thing after another going wrong. And I guess on the upside, I have been walking. I've been doing the exercises that I'm supposed to. I do hand weights. I do swimming, which I think really, really, really helps. If anyone is struggling out there with any of these things that I have, swimming is the best. It just makes you feel weightless, and it's amazing for exercise. I go on the treadmill. I do stomach crunches, which I'm not supposed to, but I'm doing them anyways. And depending on how I feel, I do it in the morning and then at night. I seem to take 1 step forward and 100 steps back. I'll swim, I'll do all these things, and then I'll jar myself or something will happen, and then I'm sent myself back tenfold. So it's really difficult because you want to be active, you want to do things, you want to get out there, but you really have to be careful, because any small movement, any wrong thing, any jarring of yourself, lifting something heavy, even I go to stretch to grab something, I feel it in my back, and it reminds me of how bad this pain in my back is in really bad shape. I'm still unable to sit up in a chair for longer than like 10 minutes. I do sit with pillows behind my back. I am sitting now. I have my good days and bad days where I can handle more things at a time differently. I walk for like 10 minutes and then I need to take a break. I'll sit in a store on my walker, I'll sit down. I really need to take breaks. I'm not that girl anymore that can just go 100% without being, careful and mindful of her back. I'm not able to lay on my back still. I'm most comfortable on my side, and I'd really be the most comfortable in a ball if I could possibly go into a fetal position, but with my back, and that wouldn't be so beneficial for my cyst pain. My body's fighting on different positions to sleep. I sat in a chair for a couple of hours yesterday, and I'm paying for it today with the worst sciatic pain and burning. I can't even sit on the toilet. The pressure on the back of my leg is horrendous. I'm just crying all the time. It's just taking its toll on me mentally. Like I said before, I've been putting ice and heat, trying A535. Nothing has helped me. Really, there's no thing that makes me comfortable. I can't stand too long. I can't sit too long. I can't move too long. So I'm really in a position of I got to do what works in that moment. Lying down obviously is the best, but again, I have to keep moving, because if I just lay down, I become stiff and sore, and I've got so many things going on that even though it feels good for my back to lie down, it doesn't feel good for my endo or my IC or my chronic other pain that I have. So I have to keep moving. I have a lack of nutrients in my body. I'm vegetarian and not eating fish at the moment. So my nutrients is another toll on my body that I can't even begin to explain. The sadness, I'm super depressed. I'm fighting this battle for my life in one room, and no one can help me. I don't have that many people who want to even help me if they could. I've been to a very, very, very dark place, and I've thought I can't go on another day like this. No sleep, no food. That feeling of just a truck running over your body over and over. That bone-crushing, curdling pain. The pain where you have to hold your breath and pray it will be over soon. The pain where it hurts to blink. It hurts for someone just to walk near you because the wind of their presence knocks you over, and it hurts so bad. You contemplate death because it hurts so bad, and you're in that dark place, so you think that you not being here is beneficial, and at least you won't suffer. Sometimes all I want to do is lay there and shut my mind off and cry. I try to isolate myself because I'm afraid to cry, the kind of cry that I need to. So I usually send everybody out of the house, shut the windows, play music, scream at the top of my lungs, cry, tears running down your face, snot running down your nose, kind of screaming, type crying. Rocking back and forth, clenching your fists, almost feel like you're losing reality. That pain is all I know, all I can remember, all I have. I can't remember a good day. It hurts from morning till morning. I don't even have my nights because I don't sleep. So it's literally morning to morning, and my days overlap one into the other into the other. My stomach hurts continuously. I feel my chest super tight and closing up on me, and taking deep breaths are so painful. It feels like I'm doing it through a straw. My stomach burns every day. It feels almost like a heartburn acid reflux, but it's between my breastbone all the time and nothing I do matters. It's like a straight arrow through my back and into my chest bone. My chest burns and claws and burns and claws all day. The pain, it does mysterious things to your thinking, to your brain, to your ability to see straight. I've lost interest in everything. I don't care about my looks. If I showered, I used to love tanning. I don't really go anymore. The things I once loved are killing me to do them. So why even try? Why even try to do them if they're just killing me? Since the surgery, well, I used to be positive. I used to push myself really, really hard. Before the surgery, I would be going out. I'd be going to Niagara Falls. I'd be doing so many different activities. And now I just feel like it's pointless and I can't do them anyway. So why try? I see a different side of myself now. I buried that other girl a long time ago. I need to be this person that I am now. It comforts me. I can't care what other people think, what other people say. I don't need to stress about beauty and smaller things, because when you're sick and when you're in pain, the things you think about and the world you live in, your ideas and your dreams all change. The things you thought you knew, you don't. And the things you thought you cared about, you won't. It drags you down to such a pit of hell, and it takes every strength to pull yourself up. But with my story, I am trying to climb out, but the ground breaks beneath me, and I go deeper and deeper into that pit of hell. New symptoms, new pain, new sicknesses, new problems with my back, new problems with my body not working. I am in a constant war with my body. I fight myself daily to keep food down, to walk a few steps, to connect the signals from my hands to my brain fast enough before I drop things. I think every day for the last 3 months I've broken a few glasses, dropped a few things on paper, ruined many documents. I've tripped, fallen, slipped. I've lost my balance. I have unbearable shoulder dislocation when I sleep. I knock my shoulder out of place every time I go to bed. I feel a constant flu bug hanging over me. I never get better. I'm in a fog all the time. My days, my hours, my minutes, they all jumble into one, and I can't even tell you what I did 10 seconds ago. That's why I have to write everything down, because I wouldn't even be talking straight right now if I didn't have anything written down to you. Nothing would make sense. I'm in that much of a fog. I walk around in a constant daze. I can't even follow my own conversations. It's becoming so hard to want to exist in a world full of pain and suffering, and nobody knows how it is unless you live with it. Even the people around you don't know what it's like because they sleep at night while you lay awake contemplating death. It's a very personal journey, pain, and one that you travel alone. And you have to find ways to beat it, to fix it, and make it better. I've found ways in my own ways to help myself to get up every morning when I don't think it's possible. Just when I think I can't handle one more thing, one more bad thing happens, and I handle it, I'm still here, so that must mean something. But even with me telling you my journey this far, it doesn't even come close to the real full story. If I told you every problem, every sickness and pain, then we'd be here for hours, days, weeks even. It's not been a walk in the park for me, that's for sure. It's been a drag through hell. I've had 2 periods in the 4 months that I've had my surgery. That comes with a whole set of other problems because of my endometriosis. I can't go into detail with the amount of pain it is on top of having the back surgery to go through horrendous cramping. I just scream and cry for hours in a ball with my heating pad, gasping for air from the pain. And like I said, one thing sets off another thing. So the cramps set off the back pain, and the back pain sets off the sciatic, and so on until every inch of your body is affected. I survived this so far. I don't talk to anybody about it. I keep quiet. I'm pretty good at those phone conversations where I'm happy and I'm going around smiling and making jokes, and inside I'm dying. I've gotten pretty good at faking the words, faking the smiles, faking the laughter. I'm okay. It's almost a talent. I just walk around with my fake smiles, saving it for the shower, and cry when no one's home, so I guess that's what I have to continue to do. I'm trying to get doctors to see me to do treatments. I'm going for nerve testing. One of the current things that have happened now is that my left leg is completely dead numb from my bum to my toes, and I have no feeling or sensation or anything, so it's just dead. And they think that that could become permanent. They also think that my other discs are bulging, so pretty much my surgery was pointless because my discs have rebulged or swelling enough to bulge a bit and affect the nerves. So I'm going for nerve studies where they're going to stick needles in different parts of the nerves and see if they react. I have no muscle tone in my left leg. My right leg is like a Hulk leg. It's very strong and muscular, whereas my left is very weak and soft and flabby because it's just not working. It gets very, very, very cold, and I'm just warming it up all the time. The chiropractor is super worried about me. He thinks I should be in the hospital right now, but I'm not going. I don't want to. I refuse to be treated like some kind of pill-popping attention seeker, which seems to happen a lot to the women like me in my same circumstance. So I stay away from the hospital unless it's 100% needed. I'm in shock that I had a surgery that they promised that I would be up and walking and moving and shopping and doing all these things, and I'm worse. I'm worse than I was before surgery, and that's not what they promised me. That's not what they warned me. That's not what they told me. He shaved off one of the worst discs he'd seen. It was very, very big. He didn't remove it. He just shaved it off, meaning whatever agitated it to begin at the beginning to get it to bulge is now doing the same thing. So it's just going to keep bulging out, bulging out, bulging out. Degenerative disc disease is what I have. They think I have spinal stenosis as well. Don't really know too much about it, but that's been said as well. And my spine is pretty much like an 80-year-old woman's spine, so it's not good news for me here, but I'm trying. I have to. So I guess it's my message to you guys that when you see somebody who is in a walker or in a cane or using a cane or has a disability, don't judge them. You don't know their story. You don't know what they're going through right now, and it sucks because until you're on the other side of it, you don't know what it feels like to be in that situation. So I'm just saying, be gentle, love each other, and love yourself. And I will see you soon. Okay, guys.